People make mistakes. We probably make 5 errors a day, but human errors should not lead to medical errors. There is now proven evidence-based practices that if put in place, we can avoid people dying of sepsis. We can avoid people dying from opioid-induced respiratory depression, from VTE, from hospital-acquired infections. There is no reason for the 3rd leading cause of deaths in our country to be medical errors.
We have to create a safety culture in every healthcare system, and that comes from the top down, from the CEO, president of the hospital, to the lowest employee or poorest paid employee. Everybody's got to be on board with this culture.
We make healthcare safer by acknowledging that healthcare is a system, but within that system, the prime individual is the patient, and we as healthcare workers are there to help and support them, and we can do that by acknowledging their primacy of role.
Embracing data transparency by openly sharing patient outcomes and the exact number of preventable harms creates a rich pool of collective knowledge, fosters a culture of accountability, and drives continuous improvement.
The most important single change for healthcare safety is to have an environment, a culture in which people can speak up. Transparency is the friend of safety, and opacity, darkness, is the enemy of safety. So a just culture where people can speak up freely is the key.
A single change that could really improve healthcare safety would be better alignment and tighter connectivity between the reimbursement systems in healthcare and actual quality outcomes and patient safety outcomes.
We have to reject mediocrity. We have to realize we've come a long way in patient safety, but we still have a long way to go. We need to make our hospitals safer for every one of our patients.
Ensuring that everyone is part of the healthcare team will make sure that healthcare safety is improved beyond our wildest dreams.
We know what to do to make healthcare safer, but we're not quite sure how to implement what we know, and that's what we have to do, implement.
In one sentence, always go back to the basics. Ensure we're doing the basics 100% reliably for every single patient every time.
We should listen to our patients and listen to one another and communicate better. That will be the fastest track towards making healthcare safer.
The change that will make healthcare safer is to foster a team approach in the culture. I don't mean just culture of safety. Culture of safety is important, but beyond culture of safety, the culture of the organization.
We can improve healthcare safety by putting patients first and always use or practice patient-centered care.
Patient safety is really a team sport, and healthcare system leaders at all levels need to have robust proficiency and nurture patient safety cultures in their institutions.
The single change that I think would most improve patient safety is putting the same focus on patient safety that we put on the operational business aspects of healthcare. Healthcare is a challenging environment financially, but it's also a challenging environment from a safety and quality standpoint.
Single change that would most improve healthcare safety is to recognize the wide range of harm events that occur, not all of them related to traditional medical error.
I think we can make healthcare safer if we understand what our safety events are consistently in every hospital across the United States.
The single change that would most improve healthcare safety is to start with the measurement of safety outcomes.
It starts by understanding safety is top personal for the family, for ourselves, and this is how everybody being engaged in healthcare needs to take it personal.
We need leaders that know how to lead to reliability and foster a culture that engages everyone from the front line to the C-suite in engaging in zero harm.
The most reliable change necessary to create a safe environment is a collaborative culture between all members of the healthcare team.
We have to implement what we already know we have to change, like listening to patients, relatives and front-end healthcare workers, change culture,
implement the science that we already know is there and just do it.
The single change that would most improve healthcare safety is open communication between all providers and centers about mistakes that were made and how they could have been avoided.
The single change that would most improve healthcare safety is the elimination of the hierarchy, where everyone has the opportunity to speak up for patient safety, from the folks in the kitchen, environmental services, to nurses, to physicians, and all.
We must make healthcare safer by learning about the risks to causing harm to patients as we care for them, and making sure we use that learning to drive daily improvements in healthcare safety.
The single change that would most improve patient safety is recognizing and using the power of artificial intelligence to structure unstructured data and give a more accurate diagnosis and treatment that's truly personalized. That's the power of AI, and that's what's going to make healthcare safer.
Healthcare can be safer if we work together and we are transparent and also ensure seamless communication with one another.
I believe the most single important change that can improve healthcare safety is to educate the people that were in C-suites of the healthcare organizations on human factors and safety culture.
The single most change that we could make is to have the will, knowledge, and action toward patient safety.
I believe we can make healthcare safer by engaging all of the stakeholders, that being policy, regulation, healthcare organizations, healthcare providers, and patients and families.
There's a lot of debate about how to use technology to transform healthcare, the healthcare revolution. In my opinion, patient safety is the real healthcare revolution.
We make healthcare safer by putting patient safety as paramount in all our decisions.
One of the most important things to prevent medical harm is to implement technology and monitor patients to be able to discover any potential harm that can be happening or any potential problem that the patient might be experiencing and prevent it.
I think the single most important operational change to improve safety and quality is to tie incentive compensation of executive leaders in any healthcare organization to a reduction in harm and to an improvement in various measures of outcome.
We can make healthcare safer by doing two things. First, humanizing the patient and making sure that we don't forget that they are a person with their own lives and needs. And second, by communicating both with the patient and with one another, all of us who are caring for that patient.
I think that we can make healthcare safer through collaboration and mentorship for what has been successful in hospitals across the country.
We make healthcare safer by making transparent and believable the harm that it's causing so that the public will demand that healthcare be safer. Right now, we in the patient safety movement are passionate about the need to make healthcare safer, but we have not, especially since the To Err Is Human report back in 1999, had the public join with us in the same kind of passion. Before you get to all the technical reasons and all the technical things you need to do to make healthcare safer, you need to have an overwhelming will by everyone to do it.
The key to make healthcare safer is to bring everyone on the table and to address the challenge.
To prevent medical errors, we want everybody working in the healthcare system to be focused on zero harm and realize that anybody can make an error, and therefore it's got to be in front of them right from the time they walk into the system that zero harm is the goal of everybody working in that healthcare system.
The most single important change is to understand the importance of a culture of safety within our hospitals, so that every time we as a healthcare worker listen to our patients, we see our patients as the most important person within that, but also we recognize that we need to treat them with respect, with dignity, and with love.
Culture of safety is a holistic approach that engages the entire system in prioritizing patient safety at the core of every decision-making process, proactively assessing and mitigating risks.
To make patients safe, what we need to do is to build dikes around errors, which will occur, and then protect the patient from the consequences of error reaching them. It's also important to realize that nobody wants to commit errors. This is not a matter of blame or fault. This is part of the human condition.
Implement the evidence-based practices. That's how we can make healthcare safer. There is a list of evidence-based practices that have been proven to save lives on the Patient Safety Movement Foundation's website. If every hospital implemented every one of these, we might get to zero. Zero medical errors, zero deaths. That's what needs to happen.